Hi, I'm Dr. Marisa Weiss. I'm president and founder of breastcancer.org. I'm also a practicing oncologist and mom, and also a breast cancer survivor. So I'm happy to share information with you today that could help protect your life against breast cancer. If you've been diagnosed with breast cancer, you're most likely overwhelmed, confused, anxious, and you might not know exactly where to start and what your next step should be. Just be reassured, while it feels like an emergency, you do have time to make the best decisions possible. So what you want to do is work closely with your doctor to understand what is the extent and nature of the cancer that you've been diagnosed with. Because there's only one you, and your situation is truly unique. Your treatment plan will be based on what the extent and nature of the cancer is. So upon a diagnosis, they're going to figure out, is it limited to the breast or is it involving lymph nodes? How big or small is it? Is it fast growing or slow growing? Is the cancer responsive to estrogen, to progesterone, to a gene called HER2? Are there cancer cells in the fluid channels of the breast, called lymphatic or vascular invasion, just as examples? So those are just some of the list of things that we look at to help us understand what is the extent and nature of the problem that you're dealing with, so that your treatment plan can be customized to your unique situation. During the time that you're learning about the answers to all those questions, it can feel very uncertain, and that's actually the worst time. You will feel a lot better once you know what you're up against and once you have a treatment plan in place. At breastcancer.org, we have a whole section about understanding your breast cancer pathology report. We even have a mobile app that you can download off your portable device to put in your answers, so that wherever you go, you know what the answers are to those questions about the extent and nature of your cancer situation. A lot of that information is hard to remember, and you want to make sure that you remember it accurately, so that each time you work with another one of the doctors on your team, the surgeon, the radiation oncologist, the medical oncologist, that everyone is on the same page and that your treatment plan is coordinated between the different specialties, and so that you don't feel like your care is fragmented or that things are falling through the cracks. But it does mean that you might need to learn how to speak up in a way that you didn't used to have to do. You need to find your voice, and you need to make sure that you take on your most important job, which is to protect and cherish the life that you have. And all of us, as we grow older and wiser, have to learn how to do it. I have a pair of big girl pants in my office that I have there because I think about it, that we're all, we would prefer to feel like little girl and mom take care of us, but we have to sort of rise up and feel our inner strength and use that to take on the challenges that life sometimes gives to us.